from the American Academy of Pediatrics.
Few things scare me as a pediatrician and mom. Drowning is one of them. As a mom who loves to take up invitations for birthday parties in the pool, weekend getaways, and more, I know my 3-year-old could be at risk, which is why it is so important to me to take steps to protect them. Today, we're going to learn about those tangible steps we all can take to keep kids of all ages safe.
There have been really tragic cases of families that I know who have lost a child in seconds. Just turned the back to start making dinner or leave the bathroom to go grab a towel if the child's in the bathtub. You have to remember within 30 seconds to maybe a minute, that's all it takes for a young child with even 2 inches of water. They can drown.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. Let's get started. Today, we're talking all about drowning prevention with Dr. Tracy McCallin, who is an associate professor of pediatrics at Case Western Reserve University and a practicing pediatric emergency medicine doctor at Rainbow Babies and Children Hospital in Cleveland. Tracy, welcome.
Thank you so much, Edith. I'm really happy to be here and I appreciate the invitation.
You know, Tracy, I wish we didn't have to have this conversation, but we really, really need to. I think most parents listening have heard the horrible stories that inevitably populate the news and our social media feeds every summer about beautiful toddlers drowning in the couple of minutes that their parents looked away. And each one of those kids is, of course, one too many, Tracy, but I wanted to ask you first to give us a sense of how common drowning really is.
I couldn't agree more with you that this is such an important topic to discuss. And drowning is more common than people think. It is actually the leading cause of unintentional injury death for children from 1 to 4 years of age. So especially in that toddler population, preschool kids, it's really, really important to keep on the radar. And for that particular population, another really important statistic to know is that almost 70% of drownings occur during non-swim times when kids were not expected to be near the water.
You know, Tracy, and I want to ask you more about that. But before that, I want to share with you that my friends and family call me crazy because I take this so seriously everywhere that we go. And to be honest, I don't mind being the crazy one and embracing this concept of layers of protection, specifically around bodies of water like pools. So, Tracy, what are those layers? And I wonder if you can sort of break them down and how they go together for our audience.
That's such an important concept. I'd be happy to do that. So one of the most important barriers, and actually the most evidence-based way to prevent drowning, is barriers, physical barriers around the body of water. And that is one of the reasons why it's so helpful for this age group, because the 1 to 4 years are very curious. They're learning to walk, they're drawn to water. So if there's a pool in the backyard that is not fenced on all 4 sides, a lot of times what happens is the house is used as that 4th side. And so it may protect others from accessing your yard, but it doesn't protect children from your home slipping out the door unnoticed into the backyard and then tragically drowning in the pool. So really, keeping that in mind, having a self-closing and latching gate, and other layers that can be helpful are putting an alarm on the door so that there's a beep, when the child leaves, if you can hear that if a child leaves the house unnoticed. There are other types of barriers like pool covers, pool alarms. There have not been evidence-based proven ways to prevent drowning, but adding some of those additional layers can be helpful. But just would want families to be aware that especially the alarms on the pool may not always go off because children can slip really quickly and quietly under the water without a splash or setting off that particular alarm. So I always like to think of those as potential additives or things that you can put on top of that fence or barrier being most important. So that's the first one. The next most important one is supervision. So having really close, constant, attentive supervision. We call it touch supervision. So we really want that designated person or water watcher to be within arm's length of the children in or near the water. And we have materials like Water Watcher tags. There are some great resources available on NDPA, the National Drowning Prevention Alliance website, where families can download a toolkit with materials. A Water Watcher tag is one of those things. And so if you're at a party like you described, there's lots of people around. What often happens is everybody thinks somebody else is watching the water, when in actuality, nobody really is. And so having that designated person who says, I'm going to take this 20 or 30 minutes, and this is my shift watching the water. And then that tag can be passed to other adults and kind of share the duty if there's a lot of people around.
Yeah. Tracy, I'll tell you a quick story that happened to us last summer. We had been invited to a friend's house that has a pool, right? And we did our swim time, just like you were saying. The swim time was over. Everyone went inside, everyone changed their clothes, and the kids transitioned to playing something else, right? I was sort of relaxed, right? We already did our swim time. I already bathed my child. I said to my husband, you're watching William, our little guy, for the next few minutes. I'm going to have a glass of wine. And he said, got it, copied. I'm watching him, right? Tracy, when I tell you within 5 minutes, I hadn't even finished pouring my glass of wine when William fell in the pool. And my husband had to jump in, grab him, clothes on, get him out of the pool. And it was so fast. I was shocked by how fast this happened. And it happened just like you said, during non-swim times. And I wonder, how do you recommend that people, couples, families communicate? Because what I tell families is have that verbal feedback, right? Like you're it. And the other person has to look you in the eyes and say, got it. I'm it. Sort of like that acknowledgement that you've tapped out and now they're tapped in. How do you talk about it with families?
That's such a great question. And I really appreciate you sharing that story. And I'm sure it was incredibly terrifying to go through that. But I think it highlights how important this is. And like you said, how quickly this happens. There have been really tragic cases of families that I know who have lost a child in seconds, just turned the back to start making dinner or leave the bathroom to go grab a towel if the child's in the bathtub. You have to remember within 30 seconds to maybe a minute, that's all it takes for a young child with even 2 inches of water. They can drown. And so I think that's such an important concept I want parents to know. And like you said, that those kind of split attention times are really high risk for this scenario where the child may slip out unnoticed. And I think we do kind of have our feelers up and our heightened awareness when we're like, okay, we're at the pool, we're at the beach. We've got our life jacket on, which is another layer of protection. And we've got our water watcher. And then when you come back for the day, the guard kind of goes down a little bit. So I think especially, when you have those young children in the home, like you said, just really communicating with those, I think double checking the doors, making sure that they're latched. If you have that door alarm, a lot of times people will turn that feature off if they have an alarm to the house because it gets kind of annoying, right? Like every time somebody comes in and out, I keep hearing this go off. But if you have a body of water in your backyard, it's really, really important to keep kids safe. So I think that's one thing, making sure everybody knows, okay, we've got kids around, I latched the door, but I'm going to be making dinner. Like you said, tag somebody in. So I think just having that watcher person who's like, okay, I'm sitting here in the room where the kids are. I'm going to kind of keep an eye right now because these are tragically when these situations happen, like you said.
Tracy, and so far we've been talking a lot about pools. I have to tell you, we also frequently visit a lake in our family, and lakes and open water in general are a little bit different. So how would you advise parents to protect their kids there?
So you're absolutely right. Open water is a different scenario than the backyard pool or neighborhood pool like we've been talking about. Another important thing I want families to know is that open water is actually a higher risk drowning scenario for adolescents. And they are the second highest risk drowning group after the 1 to 4 year children that I talked about. So we described that scenario and why they're at higher risk. The adolescents are at higher risk in the open water settings because they may have increased risk-taking behavior. There might be some peer pressure involved. There could be substance use, alcohol use, and things that put them at higher risk. Also, when you're in an open water situation, there can be currents, there can be natural things about the environment that also put kids at risk, and they may not be thinking about, or it may not be cool to put the life jacket on if they're with a bunch of friends. And so those are really important things to think about.
Yeah, totally. So since you're mentioning teenagers, and I definitely meant to ask you about them, how should parents think about teenagers differently? How do we talk to teens about water safety? Because at this point, I'm assuming they know how to swim. They've taken swim lessons, right? The supervision doesn't work the same way. So what can we do, Tracy, to keep them safe?
Yeah, so I think, like you said, a lot of teenagers do know how to swim, maybe not all. So still making sure that parents have those conversations if they're going to be hanging out somewhere in the summer at somebody's beach house or lake house, that they're aware, and the parents of the child, whoever they're visiting or staying with, or if it's a relative, are aware of their swim ability. And even strong swimmers can drown. And so we always recommend having a buddy. So if a teenager is going to be swimming, making sure they have somebody with them so they're not going out alone into the lake or ocean or open body of water. And I think just like we talk about other important things with our teenagers to keep them safe, about substance use, about peer pressure, different things, we want to think about including water safety in those conversations if they're going to be in a setting where they need to think about that, and just really helping them understand the risks and just putting it in the front of their mind so that they can be a little bit more thoughtful about it when they're in those situations.
Yeah. Wish we could be there for each and every one of those situations, but we just can't. So the conversations become so important. Tracy, let's go back for a second to talk about swim classes. And I specifically want to ask you about this because I recently realized that there are two types of swim classes. And again, I'm thinking about younger kids, but there's almost like cute swim classes and swim classes that actually teach water safety skills. And sometimes the ones that teach water safety skills are also cute, but the cute ones aren't always teaching water safety skills. So at what age can we reasonably expect our kids to be taught real water safety? And what does that look like, Tracy?
That's such a great question. And honestly, I think sometimes a hard topic for pediatricians to counsel about or have all the information that families may be asking. And so with some recent publications that are coming out, we are revising the AAP policy statement and technical report on drowning, which will be coming out this year. So we are working to keep pediatricians updated with the best evidence so they can then pass it on to their families. I think that from an evidence-based standpoint, we think about 1 year of age being the time when you should think, okay, I want to talk to my pediatrician about enrolling my child in swim classes. And one of the reasons for that is developmentally when children become more mobile. So between that 9-month and 12-month time, they're starting to crawl, they're cruising, they're learning to walk. So when we describe that scenario about children accessing the water when we're not expecting them to do so, that risk really goes up when they get mobile. So kind of thinking right around that time, like, okay, I should be having this conversation. And the AAP recommends starting classes at age 1 if you feel the child is developmentally and medically ready to do so, which is why I suggest discussing it with the pediatrician. There are infant swim classes, like mommy and me type classes, like you said, kind of the cute classes where really it's trying to just get kids exposed to water and also a bonding kind of activity and experience that they can do with the parent. But like you said, knowing that that's not teaching what we call water competency or survival swim skills. There are other infant programs that are more rescue or teach things like rolling to back to float. And so that certainly is a parental preference and something that families could discuss with the pediatrician if they're interested. We would not recommend any consideration of starting swim until at least 6 months of age. And so having a conversation if families feel really strongly or interested in that infant swim. But I think understanding what it will and will not provide for the child is important. And so knowing that those classes will not achieve water competency skills like a child who's in 1 or 2 years of age and they have more developmental ability to lift their head up out of water, coordinate some swimming strokes, learn how to kind of turn themselves around and propel themselves back towards the wall or the side, which is all part of those water competency skills.
Yeah, perfect. And honestly, we did the Mommy and Me classes. They're so fun. They're so cute. They learn to love the water. But again, they're just not really learning that water competency, as you mentioned. So I think my next step, Tracy, as a mom, and in things that I'm recommending to my patients is to really look for the next level, right? Which is when they really learn the water competency that will hopefully keep them safe as another layer, right? It's not the only thing that we're doing, just one more layer.
Definitely. And I also just wanted to add that there are some really great resources that parents can look at. So I had already mentioned the NDPA website. They have a really nice swim class checklist that families can use because all programs are different. And so also when families are looking into programs, wanting to make sure that it's a reputable organization or school that has staff that are credentialed, that they have lifeguards available or on duty for extra layers of protection, that their curriculum is reviewed or accredited. So thinking about things like the YMCA or Red Cross being very reputable, but there's lots and lots of swim program options depending on where parents live. And so using a tool like a checklist can help them when they're trying to research different programs and decide on the best fit for their family.
I am going to be looking myself, Tracy. Thank you for that.
You're welcome.
I also, in the interest of being thorough and really just wanting to highlight what could be potential threats for kids and for families, we've been talking a lot about pools and about open water. You mentioned briefly the bathtub. What else, Tracy, should we be watching out for as a potential threat for our kids?
So there are definitely hazards in the house. So bathtub, like we said, is one. If a child's in a bathtub, that's a really important time to supervise. And so the AAP recommends not having them bathe unsupervised until the age of 6. And so I think helping families understand that, I sadly have been on the receiving end, or my colleagues in the ER have been, of children 4 years old who drowned in the bathtub. And it's so heartbreaking. I think just, again, for families to understand how quickly it can happen in the time you leave to grab that towel, like I said, or go answer the door or check on dinner. So making sure that they're always supervised during bathing. And if there are any areas of potential water in the home. So toilets are one of those. And sadly, there have been some drownings in toilets that occur. So putting toilet locks on, thinking about baby proofing the house as your child gets mobile. Remember that like the sinks or basins, any tubs or buckets of water in the laundry room, those can all be hazards. Having those toilet locks can be another barrier or layer to kind of think about. So the household water, especially for the infants with bathing, thinking about the bath seats, those are another area of risk. So especially not leaving a baby unsupervised in the bath seat or those bath rings, like they can flip over or get trapped underneath. And so all of those kind of developmental things to think about, as we then said, as the child gets more mobile, really thinking of like, what are all the sources in the home that the child could access?
Yeah. Thank you for that. I think it's so important. And sometimes we're so busy, right? We're just sort of trying to get bath time done, trying to get dinner done, that just being aware is really helpful. Tracy, as we come to the end of our show, we like to end our episodes with what we call a parenting prescription. So when it comes to preventing drowning, what is one thing you want all parents to know and remember?
That's a great question. And it's so hard for me to boil it down to one thing. I do want to just add one important thing that we haven't hit on yet as a layer of protection, which is CPR training and making sure that all caregivers are trained in CPR, especially anyone who is serving as a water watcher. As we talked about, there have been some tragic cases of second victims. As you can imagine, if someone sees a child drowning, they're not even going to think and potentially just jump in after them. And the person who tries to rescue them can't swim. And then also, kind of becomes another victim. So knowing that everybody can have both the swim training and also the CPR training, because bystander CPR, early initiation of that before emergency medical services even arrive, is one of the best factors that predicts a better outcome from drowning. And so I would really want to hit that point home, not just for drowning, for any, emergencies that may arise, but having training in how to do quality CPR with rescue breaths and compressions is vitally important.
Thank you so much for bringing that up. It is so, so important. I hope everyone listens and looks for an appropriate CPR training course in your community. There's really so many of them out there that it's really not that hard if we make the time to make that a priority. Thank you so much, Dr. Tracy McCallin, for joining us today.
You're welcome. Thank you for having me.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP. And be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos,
Kathy Jewell,
Claire Keating,
Doug Nagel,
Jackie Ortega,
Susan Stevens Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.